Roughly 2,000 Americans get heart transplants every year in the United States. Not everyone with severe heart disease qualifies for a transplant. In this morning's Health Watch, Fox News' Marilyn Deutsch introduces us to a man who's trying to meet the requirements for a heart transplant.
If it looks like Keith McIntyre is working hard, he is. It's a matter of life and death. Keith has lost 20 pounds, but he has more to lose if he wants to be healthy enough to undergo a heart transplant. He's already gotten some of his problems under control, like his diabetes, and he's off dialysis, his kidneys functioning again. It's been a rough year for Keith. 73 days in the cardiac ICU for heart failure. At Providence, they stabilized him with a temporary heart pump first, then implanted a more permanent pump called the LVAD that is connected to cords and batteries outside his body. The LVAD, or left ventricular assist device, is a bit cumbersome, but
considering the alternatives, it's really not that much of a bother at all.
If he didn't have that, he probably wouldn't be here today.
Providence cardiologist Jacob Abraham shows us how the pump works.
Ultimately, it goes into his abdomen, and this cord is tunneled under the skin and ultimately up to the pump that resides inside his heart.
The pump takes blood from the heart to the rest of the body, something Keith's heart cannot do on its own. The LVAD is often used as a bridge to a heart transplant.
Our longer-term hope is that Keith will eventually be a candidate for a heart transplant.
A heart transplant should give Keith a longer, healthier life, which is important because during those 73 days in the ICU, Keith married his partner of 14 years. That wedding put on with the help of St. V's cardiac unit. Marilyn Deutsch, Good Day, Oregon.
If all goes well, Keith will be ready for a heart transplant early next year. By then, Providence's heart transplant program should be up and running.